What's going on, guys? It's your boy Pizza, Nick Mills here. Today we're going to be doing a Bed Bath occupied, assisted, anyway. So let's begin. First, I'm going to look at the orders, make sure we're doing this correctly. Then we're going to knock on the door, knock knock, and let's begin. How's it going? My name's Nick. I'm going to be your nurse today. Can you give me your name and date of birth? Okay, perfect. Do you have any allergies? No allergies, okay. So I'm going to wash my hands now. And we're going to provide privacy. Perfect. Basement privacy is all given. Okay, perfect. Now, we're going to grab the gloves. Appropriate PPE. Now be. Gloves up. Got it. Okay. Get the gloves on. Oops. Okay, there we go. Now, I'm gonna ask my patient if they can bathe themselves. They cannot. Do you have any preferred way of bathing? All right, perfect. They do not. So we're gonna raise the bed for working height. About hip level. All right, there we go. Now, go on the other side. Now we're gonna put the blanket on. And then we're gonna take their blanket off without exposing them. Obviously, they would be able to hold this blanket, but And usually I would put this in a bin, but bin's over there, so Kobe. And now we're also gonna take the gown off too. R.I.P. Take the gown off. Okay. Arms. I'm gonna keep them covered up. Covered up. We're okay. God, this place. Take the gown off. Okay, gown's off. Now we're gonna begin washing. I got one bucket here with soap and warm water, 105 to 110 degrees Celsius. And we got another one, just regular water, same temp. So we're gonna start with the non-soapy water. Grab a cloth, water. Now we're gonna start with their eyes. Work our way into out. Bam, bam. Toss it. Grab a soapy one. We're gonna get their face. Just some strokes around the face, areas. Then we grab a new one. Do their neck. Okay. Now we're gonna do their arms. We're gonna do one arm at a time. We're gonna start from distal to proximal. Start from the top, one stroke down the arm, switch, another stroke. Then we're gonna turn it and go inside, 2 strokes, switch it, and we're gonna do their armpit. Armpit. Now let's go around to the other side, cover them back up. I did the other side. Same thing I just did. Now we're gonna do her chest area and abdomen. We have privacy, so. Stroke switch, another one, we're going to switch again. We're going to go down here, all the way down here, and do their, abdomen area. Then we're going to cover them back up and go down to their feet. Start with their feet. So, expose one of the toes. Now we're going to swap, of course. We're gonna do their feet. We're gonna go in between their toes, make sure it's all good in there. And while I'm doing this, I'm grabbing another towel and pat drying. Every single time I'm pat drying. So we're gonna go in between the toes, make sure we do the foot, bottom of the foot, and we're gonna toss because that's dirty, that's real dirty. So we're gonna grab a new one, and we're gonna go up the leg. One stroke, switch, another stroke. Now below, I'm gonna check here, of course, if we need to, for our assessment. And then we're gonna switch again. we're gonna cover back up. And now I would do the exact same thing on the other side. Now, we're gonna move on to perennial care. Yeah. We're gonna do perennial care. I'm gonna pull this up. Man, we're about to expose you. And I'm gonna wash you down there. Okay, so now, we start with the outside and work our way in. So of course we're gonna go, nope, we're actually not gonna do that. Inside, work our way out. Nope, we're not gonna do that. Out and work our way in. So first we're gonna do on the outside of the, put that back in there. Put that back in there. Okay, so anyway, out, work our way in, toss them. And we're gonna toss them again. Of course, we're going to spread the legs. And we're also spraying, everything else. So now we're going to go in here, go to the labia majora. We're going to spread them. Labia majora on the right side, switch. Labia majora on the left side. And now we're going to go straight down the middle. We'll spread them, of course, and go straight down the middle. We're all done there. We're going to toss that. Now we're going to work our way to the back. Cover them back up, of course. Provide some, almost strip there. Now we're gonna flip them over. Now we're gonna make sure we provide as much, decency as we can. So we're gonna, with my assistant, we're gonna flip them over. 1, 2, 3. Okay. She definitely had it there, 100%. We're gonna move the legs back. And now we're gonna start with the back. And while I'm doing this, there's someone holding her up. You know what I'm saying? She's being held up. New towel. Now we're gonna expose. Go over the back. No 1. Switch 2. Then go right there. And we're gonna switch now. Here's where it gets crazy. We're gonna do their anus. So we're gonna go for here. And now, of course, we're going to go front to back. So we're going to go on the sides, side cheek, other side cheek, and then we're going to go straight down the anus, and we're going to work our way down the crack, if that's what you want to call it, down the crack, and then toss that, of course. I'm pat drying everything. Everything's being pat dried, and now we're going to switch them back over. Now we're going to put their new gown back on. Because they're all clean now. We're going to gown them up again. Jesus Christ. Of course, we're going to keep this on them while we're going to do this. Watch this. Also, I switched my gloves right before I did perennial care, and you saw it. I know you did. I know you saw it. So we're gonna do that. The arms. No, arm. Then we're gonna grab our blanket from before. We're gonna put this back on. And we're gonna take the blanket out and into the hamper. Now we're all done. Now we're gonna take our gloves off. We're gonna lower the bed. Actually, we're gonna lower the bed first. And then we're gonna give them a call light. They got their call light. Not on my face. We're gonna take the gloves off, wash our hands and get up out of here. And they're in a comfortable position, I asked him about that, of course. And now, follow me on YouTube, subscribe. We're done here.